What is the lifespan of an implant and what kind of maintenance does it require? Nowadays, there are actually a lot of misconceptions about implants. For example, patients often think, "Doctor, I've had all my teeth removed. I don't have any teeth left in my mouth, so there's nothing left that could decay or cause pain." But, we place the implant into the jawbone. Once we have the right length and diameter, we insert the implant into the jawbone. After waiting about 3 months, once the process we call osseointegration, where the jawbone fuses with the implant, is complete, we move on to the crown phase. After we make these crowns, inside the mouth we have the implant and abutment piece, and then the crown on top of that. Now, if we don't brush our own teeth, cavities and infections can develop. As a result, bone loss or gum recession can occur. The same things can also happen with our implant-supported crowns or implants. The main reason if we don't brush properly or brush incorrectly, when the gums recede or the bone deteriorates, the neck of the implant becomes exposed. When this exposure increases further, there is no bone left to support the implant. That's why we experience looseness in our teeth or in the implant, and the implant can even fall out. This is what we call a failure. So what should we do to avoid situations like this? Let me put it this way. Just as we brush our own teeth when it comes to crowns or implant-supported teeth, I think we need to be even more careful about brushing. Because while our natural teeth have more surfaces that are easy to clean, once we get a crown, those surfaces become a bit harder to clean. That's why, in addition to brushing when we do crowns or for patients with implant-supported crowns, we usually recommend brushing using interdental brushes and what we call an oral irrigator, which sprays pressurized water into the mouth to clean those spots where the brush can't reach and that we can't fully clean using the force of the water. When we pay close attention to these oral care routines, we actually prevent bacterial buildup in those areas, which in turn helps us prevent gum recession or bone loss as much as possible. So, when we place an implant, our intention is actually for it to last a lifetime. Similarly, when we make a crown on top of an implant, it's not so that we replace it every 5 years, but rather so that it can be used for a lifetime. But if we neglect brushing or proper care, and gum recession or bone loss occurs, what we call failure happens. The less we take care of it, the sooner it happens.